Bugono Health Center 4 in Iganga district serves a community of about 14,000 and is the only health facility in Bitende sub-county. Lydia Mwanje is the in charge of the facility, where she's been working for 6 years now. At the health center, it was difficult to identify the health workers at the facility. They have no gowns, which made it hard to differentiate them from the patients and other members of the community. We asked why they had no gowns on.
So many efforts have been made through the DHO's office to reach the necessary people, the necessary offices to give us the uniforms, and measurements have been taken on different occasions. And the last measurement that was taken from us was 2013, when they took measurements for staff, but up to now, no delivery of uniform has ever been made.
Unlike other health centers in the country with poor infrastructure and old equipment, the outlook here is different. This theater was constructed in 1996 and was fully equipped. But 21 years down the road, it has not had any patient operated on.
Most times adverts are made, but these people never apply. But there is an effort to advertise and look out for them, but they don't apply and they don't turn up for this job. And this has been a major challenge since.
And I'm shocked that the government did all that, but failed to identify an anesthetic officer who is able to do anesthesia or sedate the patients before they are operated on. It is so surprising that the ministry could spend so much money on building the structure, on equipping it, on deploying doctors, and yet that facility for more than 10 years is not functional.
The entire district has only 2 anesthetists, as many have decided to opt for private business due to low pay in government facilities.
Usually for someone to train as an anesthetic officer, they have another training they have acquired, either as a nursing officer or a medical clinic officer, that they need to go for further, then they go for further training as an anesthetic officer. But during that training, they come back and their scale is not like, their salary is not changed.
The situation is worsened by the fact that the health center has nowhere to put bodies of the dead.
We get forced to keep the bodies in certain rooms on the ward. But still that one has so many challenges. In case that person who has passed on has a contagious disease, so many people will get affected. And yet if they were kept where they are supposed to be, you would have saved the community from that. And still it is inconveniencing to other people on the ward. You will find that when someone has died and then they see you putting them in a certain room, they discharge themselves, like they run away.
Annually, Uganda loses about 500 doctors to neighboring countries due to poor remuneration in government facilities, which has seen the doctor-patient ratio at 1 to 24,000, which is way far above the World Health Organization recommended ratio of 1 to 1,000.
My plan is to engage the Ministry of Health so that I can amplify these problems. And if I fail, I'll be forced to raise these matters on the floor of Parliament, so that maybe Parliament can either pass a resolution or force the responsible minister to act on these problems.
There are only 644 anesthetists in the country.